Well, good afternoon, everyone. My name is Michael Stoltz. I've had the privilege of being a mentor for the past 3 years. I'm probably better known as the father of Elise Dickerson, who also has been a mentor, a successful businesswoman, and entrepreneur in her own right, as well as the husband of Elaine Stoltz, a successful business person for the past 25 years. Now, as you see my gray hair, the wrinkles on my forehead, and I tell you that I'm a doctor, your first impression is probably going to be, boy, here's an old curmudgeon physician who would be against any new technology that would interfere with the traditional healthcare delivery system. My daughter Elise would probably say you're right about the old curmudgeon part, but I can assure you that I embrace new technologies like Obaa, because Obaa and its technology does the following. One, enhances the access to care, especially specialty care for the patient. Two, it decreases the costs of care, the actual delivery cost. Three, it keeps a record within the technology itself of the healthcare encounter. Four, it will enhance the financial status of the physicians because it improves their efficiency. And finally, it saves time. Not only time for the patient from presentation to diagnosis to treatment, but also, very importantly, that's forgotten nowadays, the time of the primary care physician and the primary care physician's office staff. So have I stimulated your interest? Do you want to learn more? The correct answer is yes. So it's my privilege to introduce Cobby Amoah and Obaa.
Hello everyone, my name is Cobby Amoah. I'm the co-founder and CEO of Obaa. And at Obaa, our mission is to make quality specialist care available to everyone in a timely manner. We exist to address a problem that we have experienced personally and that affects millions of patients, and that is long wait times. Patients in this country have to wait for weeks and months to get an appointment with their provider. This is especially true in specialty care and worse in the field of dermatology. For example, patients in Boston have to wait for an average of 72 days to get an appointment with a dermatologist. Well, this is how this problem plays out in the real world. Suppose a patient, Kara, goes to see her primary care doctor with a growth on her skin. If the primary care doctor isn't sure of what the problem is, the current approach is to hand her a card and refer her to see a dermatologist. But Kara will run into the same problem I talked about. She would have to wait for weeks or even months to get an appointment. When she gets an appointment, she probably has to travel for several hours or even take a day off from work. Instead of going through this hassle, Obaa has developed a solution to make Kara's life much more easier. We call it Prime. Prime by Obaa equips primary care doctors to provide specialist care by connecting them to remote specialists through video calls on Google Glass. So here's how our product will work in Kara's setting. Kara's primary care doctor can simply put on Google Glass, and with a simple voice command like call on-call dermatologist, they will be instantly connected to a remote dermatologist who can review Kara's case and develop a treatment plan with Kara's primary care doctor. If the dermatologist isn't online at that time, Kara's primary care doctor can record a video and send it to the dermatologist, who will review it and send a response back in 24 hours. Our approach saves Kara time because she doesn't have to take a day off work, saves her money, she doesn't have to travel, and the best part is she gets the care she needs faster. But our product isn't only about convenience. There are research to support this. 69% improvement in clinical outcomes when live teledermatology is used. Our product also works great for providers. They can earn extra revenue, work flexible hours, and patient satisfaction increases. Here's the market we're starting with. We're starting with dermatology, which is estimated to be $600 million, and we plan to expand into hepatology and other broader uses. Our business model is simple. We connect primary care doctors to specialists and charge a $250 per user fee. The primary care doctors decide how much they charge a patient for the teledermatology service. With this platform, a primary care provider who sees 30 patients a month can make an extra $15,000 in revenue every year. And the same applies to specialists too. A specialist that sees only 30 patients a month can make up to $36,000 in extra revenue every year. Since we launched the company, we've partnered with Google to get Google Glass at a 50% discount and technical support in our chosen vertical. We also launched version 1.5 of our product in October, which includes improved video and a HIPAA-compliant backend. We've signed on customers like the Waverly Health Center and the Public Health Management Corporation in Philadelphia. We've also started a small pilot with Mayo Clinic, and we plan to expand that pilot in January and grow from there. We've also previously received funding from the Clinton Foundation, MIT, and Pfizer. And we are currently raising $550,000 to bring on additional engineers onto the team and implement our pilot programs. Our team consists of engineers, designers, and public health experts, and we are committed to putting our product in the office of every primary care doctor. Dermatologists believe that the future of dermatology is one where dermatologists are connected to primary care doctors in a virtual setting. And as I've demonstrated to you today, we at Obaa are making this future possible. If you're interested in learning more about our product or trying out our Google Glass software, come talk to me afterwards. Thank you.